It was a quiet morning at the office when Dr. William Thompson, a respected urologist in Chicago, noticed a concerning pattern in his notes. At 42 years old, with 2 decades dedicated to medicine, he observed a significant increase in cases of benign prostatic hyperplasia, BPH, among his patients, especially in increasingly younger men. The office, located in a modern building in the heart of the city, was particularly busy that Monday. "Dr. Thompson, your next patient is already in the waiting room," announced Susan, his secretary of over a decade, through the intercom. "It's Mr. Robert, 45 years old, first visit." William adjusted his white coat and took a deep breath, preparing for another consultation. When he opened the door, he found a middle-aged man, visibly uncomfortable, nervously fidgeting with the buttons on his dress shirt. "Good morning, Mr. Robert. Please have a seat." Dr. William Thompson gestured to the chair in front of his desk, maintaining a warm smile. "How can I help you today?" Robert hesitated, looking at the floor before responding. "Doctor, for months, I've been having trouble sleeping. I wake up several times during the night to go to the bathroom. At first I thought it was just work-related stress, but it's getting worse." William listened attentively, recognizing the classic symptoms of BPH. As he made notes in his electronic medical record, he realized this was the 5th patient that week with similar complaints, all businessmen in their 40s. "Mr. Robert, how long exactly have you noticed these symptoms for the first time?" asked William, beginning his meticulous clinical investigation. "Approximately 6 months, doctor, but I only decided to seek help now because—" Robert paused, visibly embarrassed. "My wife insisted. She noticed that I'm more irritable and tired. My work is being affected because I can't sleep properly." During the clinical examination and the long conversation that followed, William discovered that Robert, like many of his recent patients, maintained an extremely sedentary routine, irregular eating habits, high stress levels, and most importantly, had never undergone a preventive urological checkup. After the appointment, alone in his office, William began to connect the dots. He opened his laptop and started analyzing statistics from recent years. The numbers were alarming. A 40% increase in cases of BPH among men aged 40 to 50 at his clinic over the past 2 years. That night in his apartment in the Lincoln Park neighborhood, William couldn't get those numbers out of his head. Sitting on his balcony overlooking the illuminated city, he began making notes on his iPad. Years of clinical experience told him that something bigger was happening, a social and behavioral phenomenon that needed to be investigated and, more importantly, prevented. Your phone rang, interrupting your thoughts. It was Charles, your younger brother, also a doctor, but a general practitioner. "What's up, bro? Everything okay?" "You won't believe what happened at the office today," said Charles, his voice conveying concern. "I had 3 patients, all friends, all with urinary symptoms. I thought you should know." William felt a chill. This wasn't a coincidence. "Charles, we need to talk in person. I have noticed a concerning pattern in my consultations. I think we are facing something bigger than we imagine." That night, William barely managed to sleep. His mind was buzzing with ideas, connections, and, above all, a sense of urgency. Years of clinical experience told him that he was facing a unique opportunity to make a difference in the lives of many men. He began drafting an ambitious plan to create a comprehensive program for men's health awareness and prevention, something that could truly shift the current paradigm. As he organized his notes, William realized that he would need to tackle not only medical issues, but also deeply rooted cultural barriers. The challenge would be immense, but he was determined. Medicine had taught him that prevention is always better than cure, and now it was time to apply that principle on a larger scale. The next day, William met with Charles at a cafe near Massachusetts General Hospital, where both had completed their residencies. The place brought back memories of their training days, when they shared dreams and ideals about how they would transform American medicine. Now, years later, they were about to discover that those youthful ideals could still become a reality. "You won't believe this, William," Charles began, nervously stirring his coffee. "After we talked yesterday, I started reviewing some medical records. The number of patients with urinary complaints has increased drastically in the last few months, And the worst part, most of them are young, professionally active men. William nodded, recognizing the same pattern he had identified. "But there's something you need to know, Charles," he said, hesitating for a moment. "I noticed that you yourself have been showing some classic symptoms of BPH." Charles froze, his coffee cup suspended in midair. His face showed a mix of surprise and embarrassment. "What do you mean?" "I've observed it during our recent meetings. You always ask where the nearest restroom is, go several times during our family gatherings, and seem more tired than usual," Dr. William Thompson explained gently. "As a doctor, you should recognize these signs." The silence that followed was telling. Charles looked down, finally admitting, "It's been a few months since I started feeling some discomforts. But you know how it is, right? Doctors are the worst patients. And that's exactly why we need to change this mindset," William emphasized, leaning forward. "If we as doctors don't take care of ourselves, how can we expect our patients to do so?" The conversation went on for hours. Charles finally opened up about his symptoms, fears, and most importantly, how professional pride kept him from seeking help. William listened attentively, not just as a doctor, but as a brother. During that meeting, an idea began to form in William's mind. He shared with Charles his embryonic project to create a male health awareness program. "We need to approach this differently," he explained, "not just from a medical standpoint, but considering all aspects, psychological, social, cultural." "Are you talking about a truly holistic approach?" asked Charles, now genuinely interested. "Exactly. Imagine a program that combines medical knowledge with wellness practices, specific exercises, nutritional guidance, and most importantly, a safe space for men to discuss their concerns without judgment." As they developed the idea, William realized that having Charles as an ally would be crucial. As a general practitioner, his brother had a broader view of health and could help build bridges with other medical specialties. In the days that followed, William immersed himself in research and statistics. He discovered that the problem was even bigger than he had imagined. Recent studies showed a direct correlation between modern lifestyle, sedentary habits, poor diet, chronic stress, and the rise in prostate issues. In his practice, he began implementing subtle changes. He created a more comprehensive questionnaire for new patients, including questions about lifestyle, stress levels, and eating habits. He also started dedicating more time to appointments, allowing patients to feel more comfortable sharing their concerns. One afternoon, while reviewing some medical records, he received a message from Charles. "I booked my appointment. You were right, we need to lead by example." That simple message confirmed for William that he was on the right path. If he could help his own brother overcome the stigma and seek treatment, he could do the same for other men. The news of William's unique approach began to spread. Other doctors at the clinic noticed that their patients were more open to discussing men's health issues. Some even started requesting information about his care method. Dr. Thompson called Susan his secretary at the end of a particularly busy day. "Have you noticed that we're getting more referrals from other doctors? They say patients are talking about your way of addressing the issue." William's first lecture on men's health took place in a packed auditorium at the American Medical Association. The initial nervousness was replaced by determination when he saw Charles sitting in the front row, offering silent support. Beside him, several urology colleagues, some skeptical, others curious about his new approach. "Ladies and gentlemen," began William, adjusting the microphone, "today I am not here just as a doctor, but as someone who has witnessed a significant transformation in men's health over the past few decades." He paused, observing the audience. "What we are facing is not just a medical issue, but a silent public health crisis." The projected slides showed alarming graphs. The exponential increase in cases of BPH in increasingly younger men, correlations with modern lifestyles, statistics on delayed treatment seeking. But what truly captured the audience's attention were the anonymous testimonials William had collected. "I'm 43 years old and thought it was just age-related problems," said one of the accounts. "It took me 2 years to seek help, and when I finally did, I realized I could have avoided a lot of suffering if I had acted sooner." During the presentation, William noticed expressions of recognition on several faces in the audience. Doctors nodded discreetly, some taking intense notes. It was clear that his observations resonated with the experiences of other professionals. "What I propose," continued William, reaching the central point of his presentation, "is a revolution in how we approach men's health. We need to create an environment where men feel safe to discuss their health issues without fear or shame." After the lecture, several colleagues approached to share similar experiences. Dr. Richard Miller, a respected endocrinologist, was particularly emphatic. "William, you touched on a crucial point. I've observed a clear connection between hormonal and prostate issues in my younger patients." The conversation with Richard extended for hours after the event at a nearby cafe. They discussed the possibility of a multidisciplinary approach, integrating urology, endocrinology, nutrition, and psychology. "The body is an integrated system," explained Richard. "We can't treat the prostate in isolation." In the following weeks, William began implementing significant changes in his clinical practice. He established partnerships with other specialists, created support groups, and developed more comprehensive treatment protocols. His office transformed into a reference center for integrated men's health. One day, during a meeting with his team, Susan brought a stack of letters and emails. "Dr. William, you need to see this," she said, emotional. "These are messages from patients and their families thanking you for the new approach." Among the messages, one in particular caught his attention. It was from a 45-year-old executive who had attended his first support group. "Doctor, for the first time in years, I don't feel alone on this journey. Discovering that other men face the same challenges has completely changed my perspective." Charles, who was now actively participating in the program as both a patient and a doctor, began to notice significant improvements in his own health. "You know, William," he commented during one of their weekly meetings, "it's amazing how small lifestyle changes can make such a big difference." William's innovative approach began to attract attention from specialized media. Medical journals, requested articles, and conferences invited him to speak. But what truly motivated him were the transformations he witnessed daily in his practice. A particularly successful project was the creation of a men's health monitoring app developed in partnership with a technology company. The app allowed patients to log their symptoms, daily habits, and receive personalized guidance. "What impresses me the most," commented William during an interview for a medical magazine, "is how men are starting to open up. It's not just about physical symptoms, but about fears, anxieties, and expectations. We're finally breaking decades of silence." The Integrated Men's Health Center, envisioned by William, finally opened its doors in a modern building in the Midtown Manhattan neighborhood. The space, carefully designed to offer comfort and privacy, brought together different medical specialties under one roof: urology, endocrinology, nutrition, pelvic physical therapy, and psychological support. "This is not just another medical center," explained William during the inauguration. "It is a space of transformation where every man can find support to take care of his health in a holistic way." The first month of operation exceeded all expectations. The multidisciplinary approach attracted not only local patients, but also people from different states, interested in a treatment that went beyond conventional consultations. One of the most successful innovations was the Whole Man program, which combined medical consultations with wellness practices. Patients participated in adapted yoga sessions, meditation, and specific exercises for pelvic floor strengthening, in addition to receiving personalized nutritional guidance. Dr. William called Dr. Patricia Smith, the center's nutritionist, during a team meeting. "We are seeing impressive results with the new anti-inflammatory diet. Patients report significant improvement in symptoms within weeks. The integration between different specialties produced surprising results. Cases that once seemed complex were resolved more effectively when approached from multiple angles." The center's success began to attract the attention of the international medical community. One day, William received an email that would further change the course of his work. It was an invitation to present his findings at an international urology conference in Barcelona. "Your innovative approach to treating BPH has sparked great interest in the scientific community, the invitation read. As he prepared his presentation for the conference, William reflected on the journey of the past few months. What had started as a clinical observation had turned into a movement for cultural change in men's health. Charles, now fully recovered, and an enthusiastic advocate of the program, began implementing similar practices at his own clinic. "You know, William," he said during lunch, "I never imagined a day would come when men would line up to attend lectures on prostate health." The success of the center brought new challenges. The growing demand required expansion, and William needed to ensure that the quality of care was not compromised. He decided to launch a training program for other healthcare professionals, sharing his methodology. "The secret isn't just in the medical treatment," he explained during the training sessions. "It's in how we communicate, how we create an environment of trust, and how we integrate different aspects of healthcare." One of the most striking stories came from a 50-year-old patient, a successful businessman who had resisted seeking help for years. After 3 months in the program, he shared his testimony in one of the support groups. "I always thought taking care of my health was a sign of weakness. Today, I understand that it's exactly the opposite. True success begins with self-care." The impact of William's work extended beyond the walls of the center. Companies began seeking him out to implement preventive health programs for their employees. Medical schools showed interest in including his approach in their curriculum. "What we are witnessing," commented Dr. Richard during a team meeting, "is a true revolution in men's health. It's not just about treating illnesses, but about changing mindsets." The eve of his trip to Barcelona was marked by a special celebration at the center. Patients, family members, and the team gathered to share stories of transformation. The atmosphere was filled with emotion and gratitude. The auditorium in Barcelona was packed with healthcare professionals from various countries when William took the stage. The initial nervousness was replaced by a sense of purpose as he saw the attentive faces of the international audience. This year, he presented the remarkable results achieved at his Men's Health Center in Chicago. "What we've discovered," William began in fluent English, "goes beyond medical statistics. We are witnessing a fundamental shift in how men view their own health." The slides displayed impressive data: a 70% reduction in BPH symptoms among participants in the integrated program, significant improvement in quality of life, and, most importantly, a radical change in patients' attitudes toward self-care. During the presentation, William noticed several doctors taking intense notes. The questions that followed demonstrated the immense interest of the international community in his innovative approach. A respected Swedish urologist, Dr. Anders Lindström, was particularly emphatic. "Dr. Thompson, your work could revolutionize how we treat men's health globally." After the lecture, William was surrounded by colleagues from different countries, all interested in implementing similar programs in their clinics. A particularly interesting proposal came from an international health organization, eager to expand the model to other developing countries. Back at the hotel, William received a video call from Charles. "Bro, you won't believe it. While you were out there conquering the world, something amazing happened here. The Department of Health reached out wanting to learn more about our program." The news was surprising. The international recognition had drawn the attention of U.S. authorities to the work being developed in Chicago. The possibility of implementing the program on a national scale opened up new perspectives. In the following days, between lectures and workshops at the conference, William participated in meetings with representatives from various countries. Each encounter revealed new cultural insights into how men's health was addressed in different societies. "It's fascinating," he commented during a dinner with colleagues, "how some challenges are universal, regardless of culture." A particularly touching moment occurred when a Japanese doctor shared how the program could help combat the growing issue of social isolation among men in his country. "Your approach doesn't just address physical symptoms, but also fundamental emotional and social aspects," the colleague noted. The final day of the conference brought a surprise. William was invited to lead an international committee focused on developing global guidelines for the integrated treatment of men's health. It was an unprecedented recognition for an American, Doctor. During the flight back to the United States, William reflected on how his journey had begun with a simple observation in his office and was now impacting lives on a global scale. His phone kept buzzing with messages from colleagues worldwide, interested in partnerships and exchanges. Upon landing in Chicago, he was greeted by his team with exciting news. During his absence, the center had received visits from representatives of 3 universities interested in including his program in the medical curriculum. "Dr. William," said Patricia, the nutritionist, "the students are especially interested in the integrated approach. They say it's the future of medicine." At home, exhausted but fulfilled, William found a special letter among his mail. It was from his first patient in the program, Robert. "Doctor, I watched your lecture in Barcelona via streaming. I want you to know that you not only changed my life, but are also changing the lives of men all over the world. Thank you for not giving up when everyone thought it was just another age-related problem." That letter crystallized for William the true dimension of his work. It wasn't just about creating a new medical protocol, but about transforming lives and shifting deeply rooted cultural paradigms. The data and international recognition were important, but the individual stories of transformation were what truly gave meaning to his mission. 1 year after the conference in Barcelona, the Integrated Men's Health Center had grown into a network with 5 units spread across the United States. The Whole Man program was now an international reference for the treatment and prevention of urological issues, with results documented in various scientific publications. On a sunny Saturday morning, William led another of the popular group meetings in the main auditorium of the center. The space, once sufficient, now barely accommodated the growing number of participants. Men of different ages and social classes shared experiences and supported each other in their health journeys. "When I started this work," Dr. William Thompson reflected to the group, "I never imagined we would be here today, with so many stories of transformation to share." He looked at Charles, seated among the participants, now a living example of how changing habits and breaking taboos could transform lives. The program had evolved significantly. Beyond integrated medical treatment, it now included healthy cooking workshops, adapted exercise sessions, and even a mentorship program where veteran patients helped newcomers. Dr. Thompson, called one of the program's longest-standing participants, a 55-year-old businessman, "We need to share something with you." The group had prepared a surprise, a video with testimonials from patients and families across the United States, sharing how the program had impacted their lives. The images showed men exercising, cooking healthy meals with their families, and actively participating in their communities. "It's not just about physical health," one of them commented in the video. "It's about reconnecting with ourselves and those we love." The impact of the program extended beyond the walls of the center. Companies reported lower absenteeism and higher productivity among employees who participated in the program. Family relationships improved as men learned to communicate better about their health needs. A particularly successful partnership had been established with Medicare. The protocol developed by William was being adapted for implementation in primary care units, making integrated care accessible to an even larger portion of the population. "The most rewarding part," William commented during an interview for a health magazine, "is seeing how we are creating a new generation of men who are more aware and proactive about their health. These men are becoming role models for their children, breaking cycles of neglect that had persisted for generations." The health monitoring app, now in its 3rd version, had become an essential tool in the program. With over 1 million users, it provided valuable data on men's health patterns and helped identify concerning trends before they became serious issues. On a particularly significant afternoon, William received an unexpected visit at his office. It was Robert, his first patient, accompanied by his teenage son. "Doctor, I brought my son for his first preventive checkup. I want him to understand the importance of self-care from an early age." That moment perfectly symbolized what William had always dreamed of achieving, a generational shift in how men approach their health. It was no longer about waiting for problems to arise, but about prevention, awareness, and continuous care. The Integrated Men's Health Center had become more than a clinic. It was a hub for cultural transformation. Doctors from around the world came for training, taking the knowledge back to their communities. The model developed by William was being adapted and implemented in different cultural contexts, always maintaining its essence of comprehensive and humanized care. Our greatest achievement, reflected William during the 2-year celebration of the program, was not creating a new medical protocol, but helping to build a new culture of men's health. A culture where taking care of oneself is not a sign of weakness, but of wisdom and strength.